This is John Wecker with WBBA-TV, and I'm joined today by Lisa Cohen. Lisa is the Executive Director of the Washington Global Health Alliance and the Washington Global Health Fund. Lisa, thank you for joining us today.
It's my pleasure.
So, I've heard it said that outside of Geneva, Switzerland, Seattle is one of the other epicenters for global health.
Yes.
What is it about this area that makes it such a unique place?
Well, first of all, the sheer breadth and depth of the sector, everything from the funding to the discovery, development, and delivery. We have the Gates Foundation ranging all the way through these phenomenal research organizations to PATH and World Vision and Medical Teams International, all working on these issues. And I think it's this spirit of cooperation and innovation here that really solidifies, and that compassionate culture that we've got.
Yeah. And what's the role that WGHA plays in all of this? What's your unique contribution?
Well, we're sort of a matchmaker. We're an aggregator for the organizations because, believe it or not, you know, a lot of people, even if they're working in similar areas, they don't know what each other is doing. And in these times, all of these issues are resource constrained, as we know. So if we can help organizations know what each other is doing so that they can partner more effectively, have better outcomes, then everybody wins.
Yeah. A couple specific examples that you would like to highlight to show this magic that you're talking about?
Well, one is that we've worked bringing Madigan Research Center and introduce them to all of the global health organizations. And they, of course, are working on a lot of the same issues, whether it's malaria to maternal and child health, those sorts of research areas. And so they had never heard of PATH. They'd never been to the Gates Foundation. They weren't connected with Seattle Children's and Seattle Biomed, Center for Infectious Disease Research. And so we brought those folks all together, and now all these partnerships are spinning out. The Seattle Children's and their Global Alliance for Prevention of Prematurity and Stillbirth. Those sorts of things are spinning out. We are working, believe it or not, inspired by the Seattle Sounders. We've brought together a group that's working on a clean water and sanitation project in Tanzania, and that's the University of Washington, PATH, WSU, and World Vision. All those organizations had been working in the same region of Tanzania, in Arusha, for more than a decade. They didn't know each other was there.
Wow.
They all have expertise in water and sanitation in different ways, and we're pulling them together and getting a project going with them.
Wow, what a great partnership with so many institutions. You know, we're here at LSINW where there's a lot of networking going on. So what kind of opportunities do you see here today for these kinds of partnerships to grow, develop? What do you...
Well, I am more excited, I've got to say, this year than any time in the past, and I have never missed an LSINW. But now, in the past, we've talked about the public-private partnerships and the importance of companies partnering with the nonprofits that are doing some of the research. And that's been a little bit of lip service in the past. Everybody knows we need to do it, we want to do it, but it's not necessarily been a reality. Now it is. And I can point to 3 WGHA members who are stars, are going to be featured here at Life Sciences Innovation Northwest. So there's Kineta, there's Theraclone, and Just Therapeutics. They are all working on developing delivery products and research products that are going to be able to be used not only in the developed world, but also in the developing world. And they have in mind that end game of what can we do that's affordable, that will have access to people of all, you know, no matter where they were born, and what their economic station is.
Wow, that's really exciting. You know, I'm going to ask you now to, if you wouldn't mind, just stepping above the Seattle and sort of look in a more global perspective. Because, you know, we hear about Ebola and MERS and a lot of these challenges that the global health community still faces. What are you seeing positive? What makes you sort of excited, bullish for the future in global health?
Well, as horrific as the Ebola outbreak was and continues to be, it has taught us so much, and people have really stepped up to put funding into more research to try to anticipate these things and deal with them faster. We're looking at system strengthening, and that's what a lot of the participants here at LSINW can help with, cold chain, and how do we think about organizing delivery and things like that. But that emphasis on basic research, that we can't stick these things on a shelf because it's a neglected disease and it's not going to make a lot of money. We need to think about the impact down the road, what could happen 5-10 years. We're seeing a resurgence of dengue here in the United States, chikungunya, which could be a huge problem. And so I think that the organizations here are thinking about these problems, and I'm optimistic that there's going to be more funding and more attention going forward.
Great, great. And now I'm going to bring it down to a very individual level. I'm thinking about sort of man on the street here in Seattle, woman on the street. You know, the health and well-being of people in far remote places in Africa and Asia probably don't mean a lot to them. So what would you tell them why they should care about what happens in some of these places?
Well, first of all, I think that we need to remember that many of the people who will be paying attention to this, we were lucky because we were born in a zip code that provided us access to education, to health, things like that. And as we talk about the health of the people most in need, it can be international, but it's also right here domestically. We have a program called Global to Local, where we're using what we've learned in the developing world and applying those lessons and technologies here in the United States, right here in SeaTac, which has the most diverse school district in the country.
Wow.
And the chasm between the health of the people in Medina in King County versus in SeaTac and Tukwila is as bad or worse in Kenya and other places. So we can take these lessons we've learned, these devices, diagnostics, therapeutics that are being developed by the organizations here, and apply those here and lower our health care costs.
Wow, that's really exciting. So I understand that personally your background is in broadcast journalism, particularly TV. So is there a story? What is it that made you so passionate about global health?
Actually, John, you will appreciate this story. I worked for all of the stations here as a producer and was very fortunate to meet all sorts of amazing people. But in the year 2000, I was working at King, and the Gates Foundation, in their first year or so, invited us to come with them on one of their first international trips. And it was to Ghana, the Gambia, and South Africa. The Gates Foundation's first head of global health was Gordon Perkin, the co-founder of PATH.
Yes.
So it was a very small group of us for 3 weeks going to those 3 countries in the midst of the HIV, TB, I mean, just horrific situation. And Gordon told me about PATH, and he showed me the technologies. He showed me the vaccine vial monitor and the solo shot syringe. He was carrying all of that with him, and the Uniject. And I was taken with that, and when I saw the devastation in those countries, as you have seen, and the coffin makers setting up right outside the hospital because so many people were dying, and people literally not saying the word AIDS because it was too frightening. And I felt like I needed to do something. So I came back and got involved with PATH. I just begged them to do something and raise the profile about these issues. And then from there, as I learned more about the community and the amazing work being done, I basically wanted to hang around all of you people as best as I could, as much as I could, you know, and highlight what you all do. So with backing from PATH and the Gates Foundation and Center for Infectious Disease Research, the UW, and Fred Hutch, and WSU, we got going.
Thank you so much for your compassion and your passion and your energy and your commitment, everything that you do, Lisa. We really appreciate it.
Thanks, John.
So I've been here today with Lisa Cohen, Executive Director of the Washington Global Health Alliance. Lisa, thank you for taking the time to speak with you.
My pleasure.
And I enjoy speaking with you. So for WBBA-TV, this is John Wecker.